Let's just have a little listen to it.
Does it sound okay?
Most of the time you'll know if there's something not quite right with your baby. Sometimes you'll know he's just grizzly, but if you can't put your finger on anything specific, don't hesitate to take him to your GP. With new babies, it's hard to say what will turn out to be normal and what won't.
Can you tell at this age?
Yes, yeah. You're listening for some little clicks and squeaks, and whether the hips pop out and whether there's a full movement, everything's absolutely perfectly normal there, so no worries. He's a very healthy little boy.
Right.
Long may it continue.
Right.
Knowing when and when not to contact your GP over things like your baby's crying can be difficult, but rest assured that most GPs are keen to help new parents and will almost always see a new baby, even if it's just to reassure you. When you phone the surgery, tell the receptionist the age of your child and he or she will probably be able to fit you in. If in doubt, pick up the phone and ask to speak to your doctor, or even the practice nurse. If your baby shows any of the following signs, you should seek medical help. If she's having fits, is not breathing or is unconscious, turns blue or is very pale. If she has difficulty breathing or her breathing is very rapid, or if she is grunting. If she has any unexplained bleeding from any part of her body. And if she has a high temperature that does not come down after you've taken measures to bring it down. And if she's exceptionally hard to wake, unusually drowsy, or does not seem to know you. If your baby has a fever, you need to try and lower her temperature. This will make her feel more comfortable and will reduce the risk of convulsions which some children can get. You may help to prevent these by spotting a fever early and bringing it down with the following steps. Cool the room. Strip the baby down to a nappy. And in older children you can try using paracetamol. If this does not work, you can try sponging her with lukewarm water. This cools by mimicking the action of sweat. Breastfeeding can also help her not to dehydrate by keeping her fluid levels up. All newborn babies with a temperature should be seen by a doctor. If in doubt, you can telephone.
The backup's fantastic. I mean, like I said, the GP called round. She rang up, can I come round and see you, just because she'd heard that he was here, to let us know that she's there. Any problems, ring her. The midwives are in every day, or if they're not in every day, they're on the telephone. You have an on-call number that is, you know, they're on there 24 hours a day, 7 days a week. And the people, you know, we know everyone and they're really nice, and I think they know that we're not daft, and if we're worried, they'll come. And I feel quite secure knowing that they're all out there. If I need help, I'll ask for it, and it's there. And you also know that they are, you know, they come straight to your home and they don't think you're stupid. You know, if I suddenly said, oh, one of his toes has gone blue, I think you've got to come and look at this, they'll come.
You'll be reminded by your health visitor about inoculations at the clinic or with your GP. At 2, 3 and 4 months, he'll be offered the triple vaccine against diphtheria, whooping cough and tetanus in the form of an injection. The Hib vaccine against meningitis is also an injection, and the polio vaccine comes in the form of drops. If you have any doubts, and some parents have, talk about them with your health visitor or GP and study the leaflets available at your medical centre. If you feed, play with and love your baby, you can feel confident you're definitely on the right track. Looking after your baby is a combination of common sense, instinct and personal preference.
Parents do sometimes say that they're overwhelmed by contradictory advice, and there's no doubt about it in this area as in every other. We are in the middle of an information explosion in the world, and of course there is a heck of a lot out there. I think, though, that what most people do is to talk to people and read books and read articles and look at television programmes and radio phone-ins, and in the end they take what fits what they were going to do anyway, or take what fits with the way they were feeling, or take what reassures them that what they find themselves doing naturally is okay. I think there's a kind of self-selection process that goes on which protects most people. I certainly can't think of anything outside medicine that any parent should feel they ought to do to their baby because somebody else says they should, if it doesn't feel right to them and if it doesn't actually make that baby happy and content. The only rule is that what feels comfortable for you and is comfortable for your baby is the right thing to do.
The problem with advice is often that you get too much of it and it's all conflicting. With the first child particularly, because you're not self-confident, it's very confusing and it's very easy to go against one's basic instinct because you're getting advice that goes against it. We got advice from relations which wasn't very welcome. A lot of older people of our parents' generation brought up children in a very different way, and it causes quite a lot of tension when they're criticising the way you're doing it and saying that you should be feeding in such a way, or I mean they did do it differently, and it's difficult for them to accept that things are done differently now, and it's difficult for us when they put their experience and their advice on us.
The only reaction to stuff that I've written that I really can't bear is the people who say, your book made me feel guilty. Geez, if it makes you feel guilty, chuck it on the nearest tip. The last thing you want is any source of information that makes you feel bad. Information is there to give you ammunition for making your own decisions and to support you in feeling good about the decisions you make. I don't think anybody has the right to say to a parent, you know, you instinctively want to do X or Y, but you shouldn't. Who says?
Just go with the flow.
Yeah, he's an individual.
We do that in everything else in our lives, so I don't see your child rearing should be any different. I'm confident in our ability to cope with what we have to cope with. I think if you take a positive overview and just make your decisions as you go along and see what happens.
I think with advice it's a question of knowing that there are people who you actually trust and then taking advice from those people.
You find mothers like yourself with newborn babies who have got the same kind of general idea of how they want to bring their baby up. Then it's the thing of kind of comparing rather than advising. Yeah,
sharing experiences, yeah.
Even before they crawl, babies can still get into trouble. They can easily roll off beds or high changing mats. If you have to leave your baby somewhere, the safest place is usually the floor, unless of course you have a dog or a cat. If you have a rather unpredictable toddler around, it's best not to leave her alone with a pet, even if it does mean you have to go to the loo together. If your baby sleeps in a Moses basket or sits in a bouncing cradle, be careful not to leave him in it up on a work surface. Babies wriggle and can move their seats, and you yourself might accidentally knock it off. Once your baby is actually on the move, you'll probably have to make lots of changes to make your house safe. The trick is to stay one step ahead of him all the time. If you try getting to his level, you might see more easily any potential danger. Use your imagination. Household cleaners, cosmetics, medicines, breakable glass items, anything precious, electrical appliances, trailing wires and anything hot all need to be kept out of reach. Also watch out for pets' foods and water bowls and cat litter trays. Doors and gates should be kept shut and stair gates should be used to prevent falls. It's all too easy to forget about that bottle of paracetamol beside your bed, and any alcohol you may have all needs to be kept out of reach.
My view was, and I think it's been okay, is to let her go where she wants to go, let her experiment with what she wants to experiment within reason, and then let her experience from that whether she was going to do it again. You know, and it seems to have worked. I mean, there have been a few bumps and knocks, and she hasn't stuck her hand into the fire or anything like that, because we wouldn't allow put a fire guard there. But with most things, my kind of philosophy, so to speak, is just to let her get on with it and kind of keep an eye, but at the same time allow her to find out for herself.
Pretty soon you will develop a natural instinct for any danger spots. You'll be able to catch them out of the corner of your eye at almost any moment and before anything can happen.